Hi, I'm Dr. Deborah Lascola with Cape Girardeau Urology Associates, and I wanted to talk today about the side effects of the medications we use to treat overactive bladder. The main side effects are dry mouth, dry eyes, and constipation. And we get these side effects with these drugs because there are receptors that are being blocked by the drug that are not only in the bladder, but they're also in the salivary glands, the eyes, and the intestines. So these are non-selective receptor blockers. So when they're blocking the receptors that are in the bladder, those receptors are also in the other organs. So what that means is the receptors in the parotid gland, which are responsible for salivary saliva production, those get blocked, so we get dry mouth related to the drugs. There's also receptors that are blocked in the intestine, so that translates into having constipation. And many patients will complain of having dry eyes, or maybe their vision becomes blurry, and that's because there are similar receptors in the iris of the eye. For this reason, giving overactive bladder medications to patients with narrow angle glaucoma is actually contraindicated. Many patients don't know if they have narrow angle or closed angle glaucoma, so we'll reach out to their eye doctors to know that for sure, but luckily narrow angle glaucoma is the more rare form of glaucoma, so most patients are not restricted just based on their diagnosis of glaucoma. There are also some of the muscarinic receptors found in the central nervous system. So when those are blocked, patients can have cognitive dysfunction or memory loss. So we're very cautious in giving these drugs to anyone with memory problems already or in the elderly. The receptors are also found in the heart. So when those receptors are blocked, patients can have an increased heart rate or an increased blood pressure. So we have to be mindful of these potential side effects when prescribing these medications. In patients that have urinary retention, or they're unable to empty their bladder all the way, or have narrow angle glaucoma, these are absolute contraindications for these drugs. So those would be reasons we would not want to prescribe these drugs to you. Many of you have probably heard of oxybutynin or know someone who has taken oxybutynin, and it's one of the most commonly prescribed medications for overactive bladder. It has been around for around 50 years, and it's one of the cheaper drugs and was the prototype for what the other drugs were made from. It does have a high affinity for receptors in the salivary gland, so actually a higher affinity for those receptors than the ones in the bladder. So patients complain of having terrible dry mouth with this drug compared to some of the other medications. It is rapidly absorbed, and the plasma concentrations of this drug continue to rise, so it can be effective for patients, but it also can have decreased efficacy with food, so we have to be mindful and remember to take it more on an empty stomach. There's a different delivery of oxybutynin called Oxytrol, and this one is a patch. It bypasses the metabolism by the liver, so patients will have less dry mouth taking the Oxytrol this way, but often complain of site irritation where the patch irritated the skin. There's another overactive bladder medication called trospium, and it is unique from the other medications in that it's a bigger molecule that does not cross the blood-brain barrier. It also has less central nervous system side effects because of this. It does need to be taken on an empty stomach as well. It is extremely food sensitive, so that can be a problem for some people to be able to take this medication. There are newer drugs that work on different receptors, and these work on beta receptors, and these medications have less risk of dry mouth, and they actually have less risk of urinary retention, but they are more expensive, and we have to use caution in patients that have high blood pressure, because it can increase the blood pressure in patients that already have more uncontrolled blood pressure. And we also can use this drug with patients that have glaucoma. It's not contraindicated in those patients.